And so the context of this is, as we know, that AI Scribes have been appearing quite quickly in the NHS for a couple of years. And there were two significant parties in that conversation. So there was the national bodies, and there were the AI Scribe vendors. And I would argue that there was a third significant party, when you think about who's in the room, that was missing from that conversation. And you can guess who that third party is by the virtue of the talk. I'm talking about patients. And so I want to talk about a project I did to try and fill in that third party, that third bit of the puzzle. And the reason that I did it is because I spent years working with patients and clinicians across the AI lifecycle, trying to figure out what the best governance nationally and locally looks like. And foundational was always the clinician perspective and the patient perspective. I could tell when a project was going to die when those two things weren't there. And if we're going to be really great at using this stuff, which I think we should be, then this is something that we need to get right. And I just want to caveat it by saying that this is just a teaser of the project, and I'll go into why it's a teaser in a second. So just as a start, sorry. Okay, so we know that there are benefits of AI Scribes. So we know from the recent annual CQC report that there is about 50% of the workforce is stressed by their work and either in burnout or leading towards burnout. We also know from research that these products will potentially help that, which is a significant thing, right? Like something that really came across from the public dialogue was how much the general public care about the well-being of NHS staff. And I think it's something that we all share within this room. But obviously, we also know that there are issues with the AI Scribes, as in they can make up information or they can omit information. So quite rightly, the national ecosystem focused on the safety of scribes. And that's why those two parties were in that conversation. But I was discussing it with a patient I've worked with for years. And I said, so this is happening, they're being rolled out at pace, we're really focusing on safety, what do you think about this? And he said, Robin, as you know, I'm part of the HIV community, and I have to tell you that the way things are right now, certain groups within my community would not share their sexual behavior while scribes are on. And that was quite a scary thing to hear, right? Because if a patient isn't sharing what's happening with their clinician, we're stuffed. And so that really motivated me to try and address this. And so I went to SERS AI, which is the exec director is Alastair Denniston. I put forward a proposal for a grant. Unfortunately, they said yes. But it was really important that it wasn't coming just from me, or it wasn't coming from Nuisance Tree, because I wanted this work to stand on its own. So I wanted to go out and commission a separate organization to run it. And I went for the Rolls Royces of organizations in this space. I went for Hopkins Van Mill. So they've done public dialogues on assisted dying, on prison reforms, on digital IDs, really contentious big topics, and really influential public dialogues. And they do it in such a great way. So if a patient needs technology to engage the public dialogue, then they will send them out podcasts, tablets. They will also give them individual phone calls to help them. They will have a counsellor at the event in case traumatic events come up. They're incredible. I'm really proud to have worked with them. And the first thing they said to me is, Robin, you need to set up a governance board for this. You need to have a group that's going to see what you're doing, that you can bounce ideas off of, and tell you when you're going wrong and redirect you. And they said, they have to be good. And I was like, how good? They were like, they have to be good. So I went for the best. I went for Protest Mystery at the King's Fund. I went for Nell Thornton at the Health Foundation, the two data and tech leaders at the two biggest think tanks in the country. We had Alec Price-Forbes at the back there. I would say is like the most significant person in AVT rollout in the NHS. We had Joe Alderman from the University of Birmingham, who is a doctor and a postdoc within digital and AI, and also a significant person at national policy. We had Octavia Reeves from the Ada Lovelace Institute, who's really known for putting public good first and holding big organizations, whether that's government, whether that's technology companies, whether that's something else, holding them to account. We had a patient that I worked with for years. We had Ellie, who is a clinician, previously worked at an AVT company, also has a PhD in this work, is my North Star in this project, someone I trust implicitly, who will also be on the panel later. It was chaired by someone who had worked at senior levels in the NHS for decades, and then I was also part of it. And then they said, okay, we're going to need to educate the patients on this topic so far so they can meaningfully engage it. So we have to put on a week of online videos so they can understand the topics. And I was like, okay, well, what kind of build should I go for? And they're like, you got to go for the best again. They're like, if this is going to hold water. And so again, I did. And I had, there was Ellie did a video. We had Dr. Jess Morley providing a video. We had, again, incredible people. And then at the end of that, the patients clearly had questions about this. They had things that you just can't get from a video. And so then we had Dr. Hugh Harvey log into the system and answer their questions, which I imagine most of you know is a significant person in this ecosystem. And then finally, we had the one-day event where a UK representative group of a spread of nationality, as in across the 4 nations, ages, long-term health conditions, AI and data protection opinions were in the room. And yeah, I just want to say that I'm really proud of the fact that the community came together to do this, to do it well. And so we were talking about 3 things, essentially. What are AI Scribes? How should they be used? And how should they be kept safe? And the first thing that really came from this was that 2/3 of the room didn't know that this was happening, despite the fact that it's being rolled out at pace, which is, again, significant, because they're the person giving across the really intimate information, right? So they have to know that it's going on, and they have to be OK with it. And there were lots of other findings, which I'm not going to go into right now, but there was one thing that I thought was really interesting, which has stuck with me. And there was this one patient that had experience of a scribe in a room. And we were like, well, it's really great. This technology is good because it should improve the patient interaction, which is very valid. Lots of people do find that. But this one patient said, I had it and it was weird because I was talking about this really intimate topic, but there was no computer in the way. They were just making eye contact the whole time, and it was too much. And it's like you can get it, right? So people who don't know, my background was originally in psychology and counselling, and so when you're giving psychotherapy, you turn both the chairs at 45 degrees, so you don't have that intensity. And something that we often forget with AI is that it changes the dynamic in the room in lots of ways, and this may be one of those ways that we need to shift the way that we're doing this. And so the next step is obviously going to be publishing the report. So we've had some really significant journalist organizations that are interested in seeing the report and writing up on it, which is really exciting. And then at the start of June, we are launching the report in the House of Lords, sponsored by a significant lord. I can't say who the lord is right now because it's not been publicly announced, but think of the most significant lord in this space. It's that one, but I can't say it. Which is really exciting. And we're going to have all the senior leaders, the kind of people that you would expect in the room from public bodies and academics and think tanks to have a panel debate discussing how we should take this forward. How should we listen to the public? How should we make this work within the UK? Which is really exciting. And I'm going to end on a bit of an unusual note, which is I'm going to talk about bees. So this is a quote that I love from Marcus Aurelius. So he was a Stoic philosopher for just over 2,000 years ago, and he said, that which is not good for the beehive cannot be good for the bee. And I think that, and I think the flip of it as well, that it has to work for everyone. And this quote got me thinking, and I looked at how bees work. And so it turns out that when they reach capacity in the hive, 5% of the bees will leave the beehive to look for new territory, which is best for the beehive. And then they'll come back together and they'll democratically decide what the best new location is. They'll work together democratically to do what's best for everyone. And obviously, bees are really important to our ecosystem. You've probably seen the UN report that talks about how important they are. And the thing that I keep thinking about this is if bees can get it right, then surely we can as well. Thanks for listening.